Morning, Roberto.
Good morning. How's everybody doing?
Good, good. Thanks
I'm
for
flying
joining us at
solo
the
today.
cabin.
Yes, lovely. I graduated to the top floor today.
Perfect. Okay, well, now that we have both you and Andrew on board, I'm going to just hand it over to you on behalf of Suzanne, Leslie, and I. Thank you once again for joining us. We have a ton of questions already filling in the boxes, and I have a few of my own, but I'll hand it over to you right now.
Sure. I can start unless, Andrew, you want to go first?
No, I'm comfortable with you jumping right in there.
Okay, so we met, I think, just before Christmas, and at that time we thought, okay, we're in gray lockdown until January 23rd. This is it. We're going to ride this out, and then I think after our last webinar, we heard that there was going to be potentially a curfew launched by the province, and everybody looked to Quebec potentially as what we could be imposing here in Ontario. That wasn't the case. There was a stay-at-home order that was issued, I think, after the gray lockdown in January. So as of January 14th, instead of going to a curfew, Ontario's moved to a stay-at-home order, and there's some clear language around the purposes, lawful purposes by which a person can leave their residence, and as well a list of places that one can attend to. So that's kind of where we're at. So it took us a bit of time to get the actual copy of the regulation, even though our phones were ringing off the hook. But I think we have a good sense now of what's in the stay-at-home order and the changes that were done as well to the other regulation under the Reopening Ontario Act. Anything you wanted to add, Andrew?
Nope.
Okay. If not, then I can just rhyme off some of our local stats that we have in our external public-facing dashboard, but as well our internal-facing dashboard that doesn't get as much publicity, but I can rhyme off some of those numbers. So externally, everybody knows on our public dashboard we have 28 active cases. 8 of those are in Quinte West, 16 in Belleville, 1 in Prince Edward County, none in Tyendinaga, Mohawk Territory, and none north of Belleville and Quinte West. So our northern areas, we have no cases at this time. We have 2 ongoing long-term care outbreaks that are listed on our website. And we are happy to report that we administered 78 vaccines this past Sunday at a local long-term care home. We did a media release after the fact because of all the security considerations around handling and transporting the vaccine. And that was the Pfizer vaccine that has to be kept at 80 degrees below zero. Internally, on our internal dashboard, our weekly, actually this is also shared on the public one, our weekly incidence rate is 14 cases per 100,000 of the population, and 0.7% of all persons tested actually come back positive. Our RO number, which is the reproduction number, is less than 1, which is great. And for every case we have that we identified, there's 3.2 high-risk contacts, people that were in close contact with the case that might also get the virus. And this is a very low number. I think last time we spoke here, I think our number was around 10 or 11. So for every case that we're identifying now, people are taking the proper precautions, and they're coming in close contact with way less individuals, persons. And percentage of cases with no epi-link in our area is about 8%. So 8% of all cases that we identify and we speak with, about less than 1 in 10, we're not sure how they acquired the virus. As you may have heard in larger centers, that number is quite large. So I can open to questions unless individuals wanted me to go over a quick overview of the regulations. The stay-at-home order is this document here. It's about 2 pages long, but it contains 29 different reasons why a person can leave their residence to do an activity. including exercise, go to work, attend at a business that is open or lawfully open, such a food premise or a hardware store, and as well go to school. The Regulation 8220, which is what drove the lockdown, gray lockdown, is still in effect, and there were some changes done to that, including restricting the hours for certain curbside non-essential food places. I shouldn't say non-essential, non-food premises that one can walk into. The hours stay the same, but those who are curbside, like a hardware store, the hours were restricted to from 7 in the morning to 8 at night. Any questions? I think the Q&A is where we get sort of to the meat and potatoes of things. So if there's any questions, Jill and Suzanne or Leslie, we can perhaps open up to that, unless Andrew has anything he wishes to add.
I'll let Andrew come in.
Oh, hello, can you still hear?
Yep.
Okay, excellent. And just a quick addition to Roberto's comments, our region is doing really well. I mean, if we were still in the color scheme, we would be in the yellow, close to the green. So we're doing well. We're comparable to the Northern Ontario region, and that's it. Everyone else is doing worse than us. So, congrats to everyone that's for doing a good job. And I guess there, I think we should start looking at the Q&As.
Oh, okay, so if it's good with you and Suzanne and Leslie, I'll just start with the very first question we have. Can employers require employees to have a COVID-19 vaccine once everyone who wants a vaccine can get a vaccine? Will there be a proof of vaccination card provided to people who get it?
Great question. So that's a hotly debated topic right now amongst public health, the health sector, and legal circles. The question, I think, will take time for us to have a clear answer on that. I think for the health sector, there's going to be probably a greater onus for the staff to be vaccinated, similar to the way they are now. For example, in public health, certain staff who have direct contact with the public, especially young families and children and pregnant women, are required to have certain vaccines. I imagine going forward, workers in long-term care in the health sector will probably be required depending on their role. And in terms of proof of vaccination, I think if you're traveling overseas, I can certainly see that being a requirement before you step on a plane, that you prove that you've been vaccinated. So in a nutshell, it's still uncertain as to who will be required to be vaccinated for sure, but we sort of have a good understanding of who might have to be, and those are in the healthcare sector.
Yeah, Roberto, I think the second part of that question was, will there be a card issued? So I know, like in this region, Hastings Prince Edward Public Health keeps our vaccination records for everybody, and you are sort of the data central for vaccines in our region. So are you guys already working on what a potential card could look like that people will get once they're vaccinated, in case they have to produce something for proof down the road?
Yeah, I know in other, prior to COVID and even during COVID, other vaccinations, we often issue a little card that says you've been vaccinated by the health unit, and it has a, the type of vaccine on it, like the flu, for example. I recall getting a yellow little card every time I get my annual flu shot. I'm not too sure about what it looks like for COVID, but I know we're using an app called COVAX, which probably will give the client some paper trail that they were vaccinated. I have to check with our vaccine manager, Alicia Haynes, and I can give you a more direct, more precise answer via email after our call as to what exactly documentation we're providing to people after they get their 2 doses.
So right now, if I go onto the health unit though, and I can get a full list of all my vaccinations, so wouldn't it just go on there and I can print that out?
Potentially, we're using, for those vaccinations, we use a system called IFAS. So you can call us and see what we have on IFAS based on what your, what we have done in terms of in vaccination in the past, but also your healthcare provider, if they've called us and updated us after they've given you a shot. This particular database or app that is going to be used for COVID is called COVAX, and I'm not sure whether it communicates with IFAS. So I just have to clarify before I say it's a green little card that's laminated and so on. I can do that after our meeting today here.
Okay, perfect. Thank you. Another kind of complex question. If film and television productions are able to resume filming under the current lockdown measures in order to create digital content for distribution, can theater companies and organizations, such as the Empire Theater, do the same to create digital content for distribution or live streaming under the current regulations? So I guess the idea is if film is allowed to create digital content, can places like the Empire Theater locally do the same thing if the purpose is to create digital content?
Potentially, depending on how the regulation is worded. I'm just looking for that section here. Everything kind of goes back to the wording in the regulation, and sometimes words get parsed and different people have different interpretation. Like, when is the doggy daycare a boarding kennel, for example? That's something that's came up recently. So just, if you could give me a second, I can look that up, or I can take a pass like in Family Feud and come back to that later, if I'm allowed to do.
Okay, no, that's fine. So you know that that's there, so we'll answer that in a moment. The other one, this one's talking about churches including singers or musicians as part of their live stream services. Under the new restrictions, can a cultural organization rent that same space to record music or spoken word presentation for future distribution through social media? So I guess the idea is, if you have a spot that's allowed to do singing or musicians and they have technicians, if they're doing it all according to the wording, can someone else use that same space? Or is it restricted to the people who are the church owner, the owner of the building?
I think there's specific language in the regulation about renting out space, I think in Schedule 1, and you'd have to adhere by that. I'm still trying to find the, here we go. So, sorry, going back to the question about stage production, it's under 63, under the category media industries, film and television production, including all supporting activities, such as hair, makeup, and wardrobe, can carry on, provided they meet the following conditions. No studio audience be permitted on a film or television set. No more than 10 performers may be permitted to be on film or television set. The set must be configured and operated in such a way to enable persons on the set to maintain a physical distance, or at least 2 meters from other persons, except where necessary for the film or television productions. Persons who provide hair and makeup services must wear appropriate PPE, and singers and players of brass or wind instruments must be separated from any other performers by plexiglass or any other barrier. So the answer is yes, provided you're considered a film and television production. So prior to these regulations, if you weren't considered to be in that category, then you probably couldn't then do what is being proposed by the theater. However, if there's a history of doing this sort of thing and it was broadcast similar to film or television, then we can look at that a little bit closer. So It comes down to a lot of specifics. What do you think, Andrew?
I think that's a fair approach to it. I'm also cautious that I'm not sure you can rent out space at this point. Have it
Okay.
open to another organization.
Okay,
Not
so,
just for childcare.
okay, gotcha. So the idea then is that if the Empire Theater had recorded concerts in the past and used the theater space as a set, in theory, they would be able to continue doing that without a studio audience and with all of the other hair and makeup PPE kind of things in place, no more than 10 people, all of the other things being considered.
I think it looks like they could. We would obviously have to comment more on the specifics as opposed to a blanket approval here via webinar. But you know, if they meet the language in the section 63, it looks promising.
And so the other side of that then is if they were, what would trigger an inspection regarding non-compliance in that situation?
Well, I think as we mentioned before, we are complaint driven, and in our area we have an agreement that goes back to April of this year with the municipalities, the larger municipalities of Belleville, Quinte West, and Prince Edward County. So premises that we normally inspect as a public health authority, such as swimming pools, restaurants, barber shops, tattoo parlors, we retain domain over that. A place like a theater probably would fall more under the bylaw, and we would give our opinion if asked officially, but bylaw probably would handle any complaints. So Brett Forster's department in Belleville City Hall.
Okay, so if they really wanted to a further answer to this, they could go to the City Hall as well.
Yes.
And it
Okay.
sounds like the same question would apply to the other one that you read, Jill, around the churches renting space. So
No, actually, I think it's very different because you can't rent space other than for childcare.
yeah, so then what I'm saying is, so this one would not be approved either, because number one, they go to rent space to an outside agency. So that would be an easy no. And then I think, you know, under the regulation, it talks about media, television, and film distribution. I think people using social media distribution is not the same thing. So I think, you know, people have to be really careful how they're interpreting those wordings. So to put a video on social media is not the same as being a television production company. So I would suggest that, you know, any business that's thinking of how the rules apply to them would contact the health unit for clarification on that.
Yeah, and that's where I mentioned, you know, words get looked over and dissected. That whole section talks about film and television production. So we would look, if this scenario was outside of Belleville, Quinte West, or Prince Edward County, and which would mean like the northern municipalities, if this question came up there and we had domain over this particular facility or proposal, we would look at what are the hallmarks of film and television production. There's got to be something that distinguishes that from other media channels, such as social media, that distinguish the industry from those things. So we would have to look at that in order to be satisfied that this can go ahead. On a meeting space, I did find the location for that, and Andrew is correct. Meeting rentals or meeting space rentals are limited to very few purposes, such as the purpose of childcare, for the purpose of provision of social services, for the purpose of delivering or supporting court services, so the legal system, for the operations of the government. So, film production is not in there.
If I can just comment, further on in the regulation, there actually is a section 68, which may be a little more applicable to what we were originally talking about, the theater, they can open for the purpose of rehearsing or performing a recorded or broadcasted concert or artistic event, some sort of performance. And then there's a requirements, you know, you can't have, there's no spectators, no more than 10 performers. So there is a section specifically related more to the theater. So we can certainly work with, you know, they could propose what they want to do, and it looks like they could do just that.
Okay, so I think we should move on to the next questions because we've got lots in the Q&A today.
Easier questions, please.
Yeah, so the next question is asking about curbside pickup for retailers. I know one of the new regulations that was added to that was saying that people had to phone their order in ahead of time. The question is asking is, can they call from the sidewalk? And what is the reasoning behind people having to call in their order ahead of time?
Good question. I think it's just Go ahead, Andrew.
Go ahead, Roberto.
No, you go ahead.
Oh, sorry, I'll be slower next time. I suspect the logic behind that was they want to be able to control for keeping the lineup outside their facilities. People keeping 2 meters apart. If they have people show up and go, you know, you got to call ahead, and they all stand outside calling on their phones while they're waiting there. And then come to pick up their pre-ordered stuff, you're going to have to turn their on. So I think the intent is just to kind of manage that crowd and control the lineup.
Yeah, I would agree with that. And a call from the parking lot, I think, would be okay, provided the business is okay with that.
Great. So then vaccinations for private care companies that do home care and in-home LTC RH, how can we approach the health unit to obtain vaccinations for staff members? Yeah, and that's a really good question. How do we find, is there a way we can advocate that?
The information about vaccination is on our website, but this particular issue has been highlighted with us. I spoke with Alicia, our vaccine manager, yesterday about this. It seems like this particular category, the private provider, has been forgotten a little bit. The province sets out the priority groups as to who's going to get vaccinated first in phase 1, phase 2, and phase 3 if there is one. So I've made Alicia aware of this. We spoke yesterday, and she is going to bring it up to the higher ups within our organization, but also the Ministry of Health, because some of these private providers are providing nursing care and PSW care in long-term care homes, and they're sort of a de facto staff person. They should be vaccinated, in my opinion.
And I think another one in that would be patient transfer as well, because they're going in and out of a lot of long-term care homes and various hospital settings as well. So there is quite a big category there. And certainly I think it's something that needs to be looked at as another group of businesses that probably should be getting some advance access to that vaccine.
Okay, is that a comment, Suzanne? Or
no, Roberto was nodding his head, so he was kind of answering.
Yes.
He was answering
okay.
a visual answer. Yeah.
Okay. So then I guess our answer is basically that yes, people are advocating for any type of healthcare worker to get vaccinated as soon as possible. There are a couple of people who are asking about, does anybody have the crystal ball that tells us when we're going to be able to open?
Yeah, there's confusion over the dates. So there's the regulations under the Reopening Ontario Act and under the The Emergency Measures Civil Protection Act are the ones that drive the time periods. From time to time, you'll hear that the government has renewed the act for another 30 days. And that confuses people. So when you hear that the act has been renewed, it's more of a housekeeping legislative legal procedure that has to take place for these laws to be constitutional and lawful. So when I get a notification of that, I keep that in mind, but I only look to the regulations for the lockdown period. So right now, this stay-at-home order, I think, expires on February 11th, unless it's further extended by the cabinet. Legislation is made at Queen's Park. Regulations are made through cabinet, so the cabinet can decide things that are in the regulations and sign off on orders in council, and that goes to the Ontario equivalent of the Governor General, who then approves that regulation. So right now, the lockdown originally was January 23rd. Now it's been extended to February 11th. The act has been extended beyond February 11th, but that's not the lockdown.
Okay, and do you anticipate that at some point we may move into that green zone and we'll go back out of this thing? And is there possibility that will happen faster?
Well, one can only remain hopeful. As Andrew said, under the old color scheme, we would be yellow, where our cases are tracking downward. But you never know. I think the government is taking a whole of the province approach as opposed to a regional approach. Originally, when COVID started, it was whole of the province approach. Then it became regional. And then it's gone back to the entire province, except for the north, I guess, in this case. But one can only remain hopeful, but it's hard to predict whether February 11th is the date or whether it's going to be extended. What do you think, Andrew? Do you have a crystal ball?
Not polished off today, sorry.
Roberta, one of the questions, I have is, does Queen's Park, does the province consult with the local regional health units when they're considering whether or not to end the shutdown? Like many people have pointed out, our numbers here are low. They were low going into Christmas, and they're even lower, after the first few weeks of this lockdown. And it is continuing to, devastate our local economy and the mental health of the people that live here. Does the local health unit have a role to play in advocating on behalf of our region? And is there something that businesses and the chambers and people here could be doing to make sure that that message is getting to the decision makers at Queen's Park?
Great question. We have weekly calls with the ministry where Dr. Williams and his staff, I think, are part of. We don't have, I don't believe, too many instances where we are in direct contact with the Premier or the Cabinet, but we, from time to time, have meetings with the local MPPs on specific items. And I imagine that Dr. Oglaza and our Board of Health Chair, might talk about lockdown, but it's always like you said, it's always useful for chambers of commerce and individual businesses to talk to their local politicians, and because they're the ones who make the laws. We're the ones who enforce the law, whether it's a great law or just a mediocre law. We have no choice but to enforce it. But it's the politicians, really. And apparently, if you watch the news reports, when Premier Ford announced the stay-at-home order, they had a very lengthy debate about, within cabinet that lasted 4 or 5 hours as to what the appropriate path forward was. So, it's not an easy job to govern a province as large as Ontario. But access to your local MPPs to let them know how you feel about the current state of affairs is part of the system. Anything you wanted to add, Andrew?
No, I think that's fair. This is not a case of health unit being anti-business, far from it. And as Roberto says, we have no say in final product. Once the product's created, and once we're dealing with the law, and we encourage businesses and people that have complaints and legitimate grievances to take the appropriate channels.
And I can only go back from what I remember on the news. I think under the color scheme, there were a couple instances where local medical officers of health publicly spoke out. I think in a Cornwall area, the medical officer of health there was lobbying for strengthening the lockdown, going from, I believe, yellow to orange, or orange to red. And conversely, the medical officer of health for York Region was publicly advocating for their region to stay, I think, orange or red, and not to go into gray along with Toronto. So there's been a couple instances where medical officers of health have publicly stated their position or desire, but those are the only ones I can remember off the top of my head.
I see that the Ontario cases are under 2,000 today for the first time in a while, so hopefully that's a step in the right direction.
Yes, that's news to me. I
Yeah.
haven't seen today's numbers. Yesterday was 2,500, I believe, but under 2,000 is definitely something that we hope keeps going.
Yeah, 1,913 they're reporting, so let's hope it continues to go in the right direction.
Yeah.
So there's a couple questions about masking and vaccinations and stuff. So there was that big question about the masking piece, because it sounds as though anybody in a business has to wear a mask all the time. But are masks required for staff who are working and maintaining 6 feet distance in areas that aren't accessible to customers and clients? And the way I understood this was, it's actually that now people who are entering into a business, into a public space, are required to wear a mask. So it's more about the people who are entering the business as opposed to the people who are working in the business, if they can do the other things. Is that true?
So masking is varied. Before Christmas, I think face coverings and masks were made mandatory if you're lining up outside a retail place, such a food place or a regular retail place that was open at the time. That's still in the books. Indoors, in places where the public still has access to like grocery stores, big box stores, masking is required both by the customer and the staff person by the regulations, unless there's an exemption on either person. Behind the counter or back of the house in a private workspace, masking is not required if the 2 workers or more than 2 workers can maintain 6 feet distance. So in some instances, you can get away with no mask, but if it's cramped quarters, then both have to mask or wear a face covering. Despite those exemptions, our case histories in our area are showing that when people unmask, whether even when it's permitted by the regulation, there's a higher risk of transmission. So an employer can set a higher standard than the regulations and say, I understand that there's exemptions under the provincial regulations, but I want everybody to be masked. So in the case of public health, as of September or early October, all our staff are wearing medical masks as they come through the doors and as they sit at their workstation, unless they're in a private office and they need to take it off to speak on the phone, for example. Conversely, an employer or a public business can bar someone from outside our area from being a shopper. We've talked about this before, the legalities of both a mask and also barring outsiders from coming into their business. If you do that, we ask that you do it in a non-discriminatory manner so that you're not infringing the Ontario Human Rights Code. For example, if someone wants to come in without a mask, they're saying that they have an exemption. You're saying our house policy is that you have to have a mask. you can't discriminate against certain people and not others. And you should offer like a curbside, an alternative service to the person, just to protect yourself legally from claims that they're discriminated against. So if you say masks are mandatory, but we're quite happy to serve you outside, that should protect a business owner. Andrew?
Yeah, I think you covered that quite well. That's a good summary.
And is there any consideration if a person in a business has been vaccinated, can they refuse to follow company policies on masking and social distancing?
Ooh, great question. We're not that far along to give you a direct answer, but one of the things that's being said with vaccines is that even when you're vaccinated, the vaccine will protect you from getting the infection, or if you do get it, it apparently gives you a milder infection, as if you didn't have it. However, the thought is right now that you can still pass it along to someone else as not being symptomatic. So they're saying that even people who get vaccinated, until we know for sure, should be wearing masks and PPE until that science is more evolved. So I hesitate to answer that question at this time.
Okay.
Yeah,
So
I would agree. I think they would have to say following the current regulation, and they'll evolve over time. At this point, yeah, I don't think you could veer from the reg.
There's a good question here about taking temperatures, and we've had this conversation before. So the question is whether or not businesses need to be taking employees' temperatures as they arrive at work. And if employees refuse to wear masks, will they be held accountable themselves, or does the business end up being held accountable? So two different questions, but I know we've talked about the temperature piece before.
So not everybody that has the virus, whether that has symptoms and has the virus, will have a fever. So putting all your eggs in one basket and taking temperature is not, we don't recommend that in public health. Instead, we recommend that you go through the survey, the screening survey that the government has given everyone, businesses and workplaces, and also ask the additional question of whether you've been told to isolate by your doctor or public health. I think only a small percentage of people actually have a fever. Some organizations have approached us on temperature checks, and we say, it's not something we recommend because it's not reliable in most cases. The other question was about masking. Yes, as of about a week or two ago, the government in their updates gave enforcement agencies the power to ticket the public, clients and staff if they refuse to wear a mask for no good reason. So if they're not claiming a medical exemption, if they're not claiming an accommodation under the Human Rights Code, they're just out of their own personal belief or principles. If public health or bylaw or the police come across a situation like that, the individual can now be charged. It used to be just the owner, which was a bit unfair.
Okay, great. The Belleville Theatre Guild has been performing dramatic Zoom readings of new local plays to an online audience. Does that imply compliance with the regulations for future productions? And then they publish the recordings on their website.
Andrew, you had some previous comments about this. I'll defer to you on it.
Yeah, my quick reading of the regulation would be section 68 of Ontario Reg 8220. That would fall under that, as far as I can tell quickly, and I believe they'd be fine doing that.
Okay, so they are fine to do that.
Yeah, as long as they comply with the requirements. Again, no spectators, fewer than 10 performers. People keeping their distance, kind of stuff.
So then the theory would be that they could meet at the Pinnacle Theater and produce a play if they were going to record it and do that. Who exactly can enforce infractions aside from the OPP and the bylaw officers?
So originally in March, it was the police that were named in legislation, and shortly thereafter, the police forces and the Association of Police Chiefs of Ontario complained to the government that they're already busy enough with other matters, that they couldn't take on such a additional workload. So the government changed it to anyone who's considered a provincial offenses officer. So that includes bylaw, that includes public health inspectors, that includes tobacco enforcement officers, that includes the officers that check highway transportation trucks, that includes conservation officers, that includes Ministry of Labor inspectors. So anyone who has a provincial offences designation, a POO, can enforce the act through ticketing and through a Part 3 summons. So they would have to go to the courthouse, swear a charge before a justice of the peace, and then return to the business and give the owner the summons with a court date. Having said that, it's an opt-in situation. So an agency can enforce, but it's up to them whether they want to or not. So in some areas in the province, there's an existing bylaw service, but they have recused themselves from enforcing it. It's not uncommon for a small municipality who has a part-time bylaw officer that they might share with another township to say, we're going to leave this up to public health and the police to enforce, and the Ministry of Labor. So it's a bit complicated. We went from only one category of officers can enforce it to everybody and their cousin. And sometimes, someone might argue that there's too many chefs in the kitchen, but I think it was necessary in order to take this on. There's a lot of complaints coming in from the public on various matters, so it takes more than just the police.
Okay, and to the point of rental spaces, can they be used for in-person training for healthcare or paramedic workers?
I believe there's a section related to training. Andrew might know the number by heart.
I don't, but I do believe that they're allowed to do for mental health and addiction support services, social services. So I suspect they would be allowed to do that, but if they want to do that, we could confirm.
I'm sorry, Andrew, I missed that.
Oh, just commenting, you could rent out the space for social services capacity or for mental health and addiction support services. So for paramedic training, I think that might fall into the social services part. So if they want to call at a later point, we could certainly confirm that. Okay.
There was one question. Can you double check section 68 of amending regulation 8220 as it affects theaters? The information she has that she's downloaded from January 14th said that says that section 68 was revoked. And maybe if you could get back to us afterwards to let us know if you can't confirm right now.
And I think,
might have to get back to you. It does get confusing when they take out sections and then they put other ones in. I'll have to, I don't have it right there, so I can't check.
Okay, we'll get back to you on that one.
Given that we've only got about 10 minutes left and we've got quite a few questions left, some of them really important. One of them is around our retailers who all have to be closed right now except for curbside. One of them, who is a larger box store, is asking about when retail is allowed to reopen for in-person shopping. Will signage be sufficient to screen customers entering the premises, or do you anticipate they're going to have to speak with each customer coming through the door?
There's a provincial tool for customers for screening, and I think if you have the signs posted, that should be sufficient. I do recall, however, when we were in a colored scheme, the language might have been different there for if you moved up to orange and red for places like shopping malls, they might have had to do it in person. But I think if you have signs and you do what's called passive screening, then that should be sufficient.
Okay. And there's another one around childcare, which I know there was a story in the news about a grandparent being charged after they looked after their grandkids. This one is asking for, childcare for essential workers is a concern should the schools not go back on the 25th. There is confusion and concern as to who can look after children without charges to the parents, grandparents, etc. Can you clarify the position with licensed versus unlicensed childcare versus who is eligible for the free childcare for school-age children? And if grandparents are willing to look after grandchildren, is this an issue?
So the case you mentioned, if it's the one that I also heard about, I think there's more to that story than was initially reported. I think there was a party involved or a gathering of more than 5 people indoors, or I'm sorry, a gathering outside of a household. There is a whole section in the regulation that talks about emergency childcare and who's eligible for it. It's Schedule 5. We can send you that information. In terms of the schools reopening, we're fingers crossed that our schools can reopen on the 25th here, and that's coming from myself in terms of the children's mental health and growth and development, as well from our internal staff at the health unit who are finding it very challenging to keep on working and doing case management and inspections while at the same time looking after childcare when their spouse also works. So this just it's affecting everyone, and hopefully that schools can go back on the 25th. I'm hearing that potentially in a gray zone at the old gray zone, the GTA area, that might get extended, but the decision hasn't been made for our region yet.
Regarding the letter about the review of retail operations and stores, and the letter that you sent out last week, and we sent this out to a few people, and I think we have some of them on the call. Yeah. There's one question, but then I would also ask if you have anything to add, and then we'll close it up. I'll send you the list of questions that I have that haven't been answered, and we'll post them as well when we get the recording of this video, if that's okay. Yep. But if a retail store decides to open and a customer goes in, is the customer fined?
So the answer is yes. So the way the regulations are worded, premises that are allowed to remain open or to stay open, and their customers are free to conduct business either through curbside or in walk-in. Places that are not allowed to be open, the owner, if they choose to open without pivoting to an allowable section, it can be charged. But also the employee, sorry, the public that goes in would be charged, could be faced with a charge of illegal gathering, because there's wording in the regulation that says that if you are entering a business that's supposed to be closed, that in itself, even if there's 4 people in there, you're taking part in an illegal gathering. So there's repercussions for the owner and the customer.
Okay. And maybe if you want to just kind of review what's going to happen this week with that whole piece and the proactive approach that the health unit is now going to take.
So what we call the Blitz or campaign this week is going to be focusing on retail and big box stores. Although we don't have that great of a footprint in terms of big box, we don't have superstores or Costco here, but we do have other places that fit into that category. But also retail, which is allowed to be open at this time. So I don't think we're focusing in on any particular type of business. We're focusing in on categories that the Ministry of the Ministry of Labor, through the other campaigns in other regions, have said, we found higher non-compliance in these areas. So we would like to focus on them, and we said that's fine. If you have that history elsewhere, maybe hopefully not, but maybe there's also a history of non-compliance here. And we propose the other categories, and we sort of mash those together, and that's where the campaign is going to focus on. There was one this past weekend in Toronto that saw, I think, about 70% compliance. And out of that, there was 11 warnings and 11 tickets given to the operators. And now, I haven't actually read that section of the regulations closely, but apparently supervisors can be charged for non-compliance. So if an inspector walks into a large business that's a part of a chain, and the supervisor is not doing their part to comply with the regulations, that person, as a store manager, for example, of a large chain, can be charged personally. That was something that wasn't, it was a bit of a loophole before. You would have to charge the headquarters, the corporation in Toronto or whatever they are, Mississauga, in some cases, but now the local person in charge can be charged as well. So that was what happened in Toronto. There were some supervisors and a couple Walmarts, I believe, or somewhere else that were given tickets.
And Roberto, I just wanted to mention too, I know in that letter that you sent out, that we shared out with retailers and others this week, just they could get some of those resources that you had in that letter. There are some new posters out there to help employers educate their employees about mask wearing in lunchrooms and on breaks and things like that. And I know that, for a lot of supervisors, like you mentioned, getting employees to wear masks and asking about that exemption can sometimes be a tricky area. Can employers ask for proof of exemption? Is that something that is within their rights, do you feel?
The regulation states that the employer or the business owner doesn't have the right to ask for what medical condition the person is asserting. But if the employee or the member of the public asserts that they have a medical condition, then you're supposed to leave it at that. So it's for privacy protection, similar to when someone in a workplace has a human rights disability accommodation. The employer doesn't have a right to know what condition they're suffering from, whether it's MS or arthritis, rheumatoid arthritis, or something like that. It's just that they have a note from the doctor in the case of an accommodation stating that the person has a condition that requires accommodation. In this case, there's no paper trail, just the person's word.
Okay, so in a case where if somebody came into a store and noticed that one of the employees was not wearing a mask, and the supervisor would just have to say they're working with an exemption, and then that would satisfy the inspectors.
Yes.
Okay. Yeah.
Unless, it would satisfy the inspectors unless the person is providing a service and they're within 6 feet of another unmasked customer. Then they're required to wear PPE in that case. In very specific circumstances, like when we had indoor dining, I think we talked about this before, where the server comes in close contact with the diners at the table, and the diners were taking their mask off to eat. In that circumstances, then full PPE is required. But we don't have indoor dining right now.
No. So if you had an employee who asked for an accommodation because of a medical reason, they could not necessarily directly serve the customers then, because they would be within that close distance.
Yes, an unmasked customer. The Ministry of Labor, we've spoken with them about this, and they're advising the business owner to reassign the person to back of the house duties or somewhere else where they don't have a need. They're not providing that service to the customer.
Okay. And I know that, sorry, just one last quick thing about this, because I know it's been a big issue for some of our retailers, especially our grocery stores, people coming in, shopping that are not wearing a mask, saying they have a medical reason. The person that's doing the screening at the door doesn't, can't ask for proof of that. But some of them have asked, can they put a sign up, or can they ask these customers who can't wear a mask to wear a face shield instead? Because I know that it actually upsets some of their other customers that see a person walking around the store that's unmasked. So is that something that's within their rights to ask for, is for people that can't wear a mask to actually put a face shield on?
If there's a house policy to that effect, it goes back to what we talked about, how house policies can supersede regulations, provided they're non-discriminatory. In the case of a face shield, it might give the public some comfort to see someone wearing a shield if they're not wearing a mask, but it's really protecting the person wearing the shield. It only protects their eyes because they're usually open at the bottom. And the mask or face covering is supposed to protect, it's supposed to be source protection. So it's supposed to protect you from the person wearing the mask. So the face shield, you could have a policy to that effect, but I would question whether it's really effective.
Okay. Thank you.
Perfect, thank you. And I will send you a list of the ones that haven't been answered. I think there was some question about the numbers, and they came out today that we're really looking for less than 1,000 in order to kind of reopen, and less than 350 in ICU. Is that kind of what you understand to be true?
Oh, good question. I think as time went on, numbers have kind of changed, and I can't, I'd have to look at the ministry slide deck that came out on January 12th to see what numbers, if any, were in there. I kind of do recall seeing something to that effect, but I can't say for sure. Andrew, do you have a more clear recollection of what the targets are?
No, I'm sorry, I don't.
Okay, it's that crystal ball again. So anyway, I will forward you kind of a list of these questions that we didn't really get answered. And if you're willing to just pen out a few answers, that'd be fantastic. Leslie, anything from you, or Suzanne, anything last bit from you?
No, thank you very much, Roberto and Andrew, for joining us today, and thanks to all of our attendees as well for joining us.
If I can quickly just make a comment, I just realized I grabbed the wrong regulation. I was a week out of date, so that one I quoted, section 68, has been revoked. So the theater group, they should just call us, and we can discuss their specific case with the most up-to-date rules.
And that was going to be my point before we let you guys go. Roberto, you guys have got a great phone line and also an online process where businesses can call and get answers for their specific set of criteria. Can you just maybe mention what that phone number is so that everybody on the line that maybe didn't get their question answered, or maybe some of the answers have prompted more questions, they can contact you directly and get the answers they need?
So if you call our main line, 966-5500, and press extension 677, that will direct you to our Healthy Environments department / inspection department, as it used to be called in the old days. And if someone picks up your call, then they will take a message and sort it and put it into the computer system for the health inspector to follow up. If you leave a message, we will pick it up usually same day, within half an hour to an hour, and do the same thing, put it into the inspection system. If you're calling out of area, like out of local calling, if there's such a thing anymore, it's 1-800-267-2803. and the same extension number applies.
And will
We
you
also
also,
have we also have web forms on our website. If you want to submit an automated inquiry, then we will return an email to you with an answer as well.
and will you be updating the website with the new posters that were linked to in that letter you sent out this week, the one about the lunchrooms and you keeping it to yourself and all those posters? Are they all being updated online for businesses to go in and download?
We have a healthy workplaces page that has a whole section dedicated to COVID, and if they're not there already, our communications department looks after that. We'll make sure that they are.
Thank you very much.
Thank you.
Okay, yes, thank you everyone for joining us today. We will follow up with the recording. We'll let you know that it's there and any of the other questions that weren't answered. So thanks again, you guys, for joining us.
Thank
Thanks,
you.
everybody.
Pleasure.
Bye-bye.
Bye-bye.